Hello, Dr. Kevin Connors again with a brief little presentation on vitamin D deficiency and cognitive decline. Interesting article that just was published recently in Neurology about vitamin D deficiency, and can they use that as a measurement of how people are doing cognitively and possible early dementia signs. They took over 1,900 elderly subjects and they measured their 25-hydroxy vitamin D levels. That's what we would measure on a person if you had a vitamin D test. And then they were given a mini mental state examination, which is a standardized examination given for cognitive function. Interesting findings. They said subjects with a vitamin D level of less than 50, or what they described in this subject was a vitamin D level less than 50 was actually a deficiency, and they said anybody with an insufficient vitamin D level was 50 to 75, which is interesting how they put that in this article, because most doctors would test a person's vitamin D levels, and if they were 33, they'd say they would be normal. That is just not normal. We want vitamin D levels high as possible. I like to see patients' vitamin D levels 80 to 120. So regardless of what your doctors say, there is really zero chance of having high vitamin D levels and a risk of kidney stones. It has just been proven over and over that that just is not true. Well, they found that subjects with a vitamin D level of less than 50 or 50 to 75 even were more likely to have declining MMSE scores. That means they were more likely already showing early signs of dementia. And they said in the article, quote, it was a strongly and independently associated, these vitamin D levels of less than 75 was strongly and independently associated with higher risk for onset of cognitive decline. So we need vitamin D. No surprise there. How do we get it? Well, you get it from the sunlight, right? Well, getting vitamin D from the sunlight requires a couple things. It requires direct skin exposure with the sunlight. And our clinic is in Minnesota. That's where we're from. And even if you're going down to Arizona in the wintertime, if you're not getting skin exposure to sunlight, you are not effectively converting that sunlight into vitamin D. So what happens is when the sunlight hits your skin, you are taking a chemical in your skin called 7-dehydrocholesterol, and it's converting it into a pre-vitamin D3 in your skin. So if you don't have direct skin exposure, you're not going to get the vitamin D from the sunlight. It also requires, in order for you to get vitamin D from the sunlight, you have to have that precursor. You have to have that 7-dehydrocholesterol in your skin. Here's a little awful little secret with the whole decreased cholesterol movement that's out there. People that are taking Lipitor and other statins to decrease cholesterol are decreasing the 7-dehydroxycholesterol in their skin. So one theory behind the increase in skin cancer over the course of the last several decades, incidence of skin cancer over the last several decades, is the use of the statin medications. Statin medications effectively decrease cholesterol, but they also decrease cholesterol derivatives. Cholesterol is made in your liver for a purpose. Cholesterol is the precursor to all your hormones. Vitamin D is actually a hormone in your body. So the cholesterol is the precursor for 7-dehydroxycholesterol. So if you effectively decrease cholesterol through using a statin medication, you are decreasing the derivatives that cholesterol forms, and you are increasing your likelihood of vitamin D deficiency in your body. So just another reason not to take statin drugs, among the many reasons not to take statin drugs. And there are many reasons not to buy into the whole cholesterol myth. So you need that precursor, that 7-dehydroxycholesterol, in your skin in order for you to make vitamin D3 in through sunlight. Now, most of us, at least in my neck of the woods, do not get adequate sunlight in the wintertime. It's just almost impossible. If you're going to go and expose your skin to the sunlight in the wintertime in Minnesota, you are going to also have frostbite. So how do you deal with the decreased vitamin D in the wintertime? Well, you can get it from your food. That's one thing, but I tell almost everybody to supplement with vitamin D3. So you want to use vitamin D supplementation. This is the ones I use. There's multiple of the liquids like this dropper bottle that are out on the market that are really, really good. Matter of fact, there's probably only a few manufacturers that actually make it, and then different supplement companies bottle it. This is designed for health product vitamin D3. The nice thing about the liquid droppers is that typically one drop is about 2,000 IUs of vitamin D. Some of them are a little bit watered down, so one drop is 1,000 IUs of vitamin D. But the one we use is one drop is 2,000 IUs of vitamin D. So if you take 5 drops, you have 10,000 IUs in the it's simple to take. You put it by your toothbrush in your drawer. It fits nicely in the drawer, and every morning you take 5 drops. It's fairly tasteless. Even kids can use it. That's the reason why I like this dropper bottle. So there's doses that I put on here, 5,000 in the summer and 10,000 in the winter. This is really based on somebody who's not really even sick. So if a person is dealing with cancer, sometimes we want to even up it greater than that, at least for a period of time. Remember, I would like people's vitamin D levels really between 60 and 120, 80 and 120 on a vitamin D test. When a person is autoimmune, your immune system tends to gobble up vitamin D in your body. The high need for vitamin D is even greater. So many people with autoimmune disease, you measure their vitamin D levels and it's really in the tank. A lot of people with cancer, you measure their vitamin D levels and it's very low as well. So many times we'll start them on 20,000 a day for the first few weeks and then drop it down to 10,000 a day. Unless it's in the summer and the person's getting outside and they have, a blood test that shows a fairly normal cholesterol level, which means their cholesterol really should be between 180 and 250 is where I want my patients' cholesterol levels. That's another discussion in itself. This picture here also shows a vitamin D Supreme, which also has a vitamin K in it, which can be good for vitamin K is also helpful for getting calcium into the bones. So if you're trying to take vitamin D for multiple reasons, a lot of times people will take vitamin D because they're trying to prevent osteoporosis, which is another discussion in itself. But then vitamin K can be helpful. So the vitamin D capsule here has vitamin K in it and a few other things. But some people like to take capsules, easier. So these ones that I like here, and you can get them elsewhere, these capsules are 5,000 IUs, so you just need to take 2 of those. It's simple to take. So vitamin D deficiency is huge in our country, and it's necessary usually to supplement. It's so easy to supplement. It's very inexpensive to supplement vitamin D, so something I'd highly suggest. All right, Dr. Connors, talk to you again.